and taking your seats. I'll introduce the President for the next session of National Conference with some more prestigious awards. Michael, thank you.
Delegates, special guests, ladies and gentlemen, I hope you've all enjoyed some lunch and been able to catch up with a few colleagues and friends, old and new. Sounds like there's an election on Sunday. But now to the really fun bit, time for some very important awards. First of all, we have the pleasure of awarding the MJA, MDA National Prize for Excellence in Medical Research. This is an award and a cash prize of $10,000 for the best research article published in the Medical Journal of Australia in the previous calendar year. And this year the award goes to a study designed to recognise and reduce medication errors in hospital discharge summaries. The winning article, Reducing Medication Errors in Hospital Discharge Summaries, a randomised controlled trial, was authored by a large group from Alfred Health in Melbourne. I'd now like to invite the Editor-in-Chief of the Medical Journal of Australia, Laureate Professor Nicholas Talley, and MDA National Representative Dr. Bhav Manoharan to the stage to summarise the research and to present the award.
So thank you very much, Michael, and thank you very much for having us here this afternoon. I'd like to acknowledge the traditional custodians of the land on which we meet today as well, and also pay my respects to elders past and present. So every year, the Medical Journal of Australia publishes terrific research. And in fact, I would argue the quality of the research we're now publishing is going up and up. It's even more outstanding now than it's been before. It's well cited. We now have data suggesting that over a 10-year period or so, the Medical Journal of Australia, in terms of Australian authors, ranks number 3 in the world in terms of citations over that period. In other words, the New England Journal and the Lancet are 1 and 2 for Australian authors, and we're number 3. I think that's a terrific testament to the MJA. So it's a real achievement to have your work published in the MJA. We now reject 89% of original research submitted. In other words, it's tough to get in, and what's more, we have rigorous processes that every article goes through. You've got to get through the editorial process. You've got to get through our statistician. You have to get through the peer review. If you get through those phases, you have to get through the revision phases that are also further reviewed. So it's very rigorous. We have double-blind peer review. It's really, really tough. So think about that, and then think about these award winners who we're very proud of, because to win this award, this very prestigious award, you've really got to be the best of the research for the prior year, which is independently judged by a panel, and I must state now I am not on that panel, I just received the results, but an independent panel that reviews the research and comes up with what they believe is the best for 2017. And that research is by Erica Tong and her colleagues, Christina Roman, Biswadev Mitra, Gary Yip, Harry Gibbs, Harvey Newnham, De Villiers Smith, Kirsten Galbraith and Michael Dooley, a multidisciplinary team. They've won this award today for their paper, Reducing Medication Errors in Hospital Discharge Summaries, a randomised trial. This was a terrific piece of research. What they did is they recognised there were many errors occurring in medication discharge in the summaries, in the discharge summaries. They did a randomised trial where a pharmacist would complete the summary and get it correct versus a standard practice, and that trial showed the error rate went from 60%, 60, to 15%. A very significant difference. And what's even more impressive is this work has been translated into a change in practice in the Alfred Health system now, such that across the 3 hospitals in that system, It's now standard of care, standard of practice that a pharmacist completes the summary, and so errors are minimised. And I want to make one other point about the research. There were really serious errors amongst this list of potential errors, and in fact the number needed to treat, the number needed to avoid one high or extreme error problem if you had the pharmacist approach versus standard practice was 10. Which means if this is implemented, which it has been, it's probably saving lives. So we're very proud of this research, and very proud that it's a randomised trial that's won the award this year. And let me say this too, the MJA is your journal. We're very keen to publish randomised trials, large cohort studies, studies that change practice, studies across every and all specialties. We want to see that research because we believe that research is important, and we believe the MJA is a place where if you publish your research, you can change practice, you can improve care, you can potentially save lives. So we hope you will consider this. By the way, too, one final plug for the journal, we've sped up. We've increased the time, or reduced the time, I should say, increased the time for success, basically reduced the time for processing. So, for example, if you submit an article now, within about a week or so, you'll get a preliminary decision, which is certainly competitive with any major journal in the world that has rigorous review. So look, the MJA, the impact of your journal, and it is your journal, is rising. We welcome your submissions. It's a thrill to be the editor of the journal and to work with the team that we have in place, and it's wonderful to see the landscape of research that comes through, including the terrific work from the Alfred that's won the award today. So congratulations, and we're very pleased for you.
So on that background, it's clear that this is a prestigious award and very well deserved by the winners of this year. And it is my great pleasure to represent MDA National to present the $10,000 cheque to the winners of the MJA National Prize for Excellence in Medical Research. A little bit about MDA. So we're a member-owned mutual organisation that was established in 1925, and we are a part of the medical profession and invested in medical excellence. MDA National has continually proudly sponsored this award alongside the MJA as it acknowledges the invaluable research within our organisation. So the title of the winning article again, Reducing Medication Error in Hospital Discharge Summaries, a Randomised Controlled Trial. When I read through this study, I was impressed with the findings, specifically that the findings demonstrated multidisciplinary care is vital to the safe and effective management of our patients, and care over 24-hour periods in hospitals needs to be established, and we need to support our clinicians at all times of the day. The authors, as Professor Talley has already listed, are Erica Tong, Christina Roman, Biswas Mitra, Gary Yip, Harry Gibbs, Harvey Newham, and Devilia Smith. Dr. Erica Tong, who's the lead clinical pharmacist from the Alfred, is here today and is going to accept the award on behalf of the research team. So on behalf of MDA National, it is my pleasure to present her with the MDA National Prize for Excellence in Medical Research 2017.
My co-authors and I are extremely honoured to receive this award. As has, I think, been mentioned, research like this can only be done in a truly interdisciplinary team, and I'm really grateful for the collaborative model of care we have at the Alfred. I'd like to thank MDA National and also the MJA for this award. Thank you.
Our next award, and the last before we move to the National Conference proceedings agenda, is one of my favourites. As Chair of the AMA Indigenous Health Task Force, I take a very strong interest in the AMA Indigenous Medical Scholarship. And during a recent visit to the Northern Territory, I was honoured to meet up with one of the people who nominated this year's recipient. Fewer than 300 doctors working in Australia identify as Aboriginal and/or Torres Strait Islander, representing only 0.3% of the workforce. And only 286 Indigenous medical students were enrolled across the nation in 2017. Established in 1994, the scholarship aims to help increase the number of Indigenous doctors in Australia by providing a medical student with $10,000 a year for the duration of their studies. I would like to acknowledge Deakin University as our premier sponsor for this scholarship. Their help is greatly appreciated. This year's recipient of the AMA Indigenous Medical Scholarship plans to not only be a doctor, but an educator. Pirpanji Reeve Nelson is a Wati, a fully initiated man from the Tri-State APY-NPY Central Lands Council region of Central Australia. And many of his family are Nankari, traditional bush doctors. Pirpanji will be the first initiated Pitjantjatjara Wati to become a doctor in the Western medical model. He will be uniquely placed to collaborate with Nankari to share knowledge and better outcomes for the health of the Central Australian community. Pirpanji from Alice Springs is a final year medical student at the University of Queensland and plans to return to Central Australia to work as a clinician and an educator. Indigenous Australians of Central Australia do not speak English as a primary language, and seeking health care from Alice Springs Hospital is a daunting experience for many of them. Pirpanji hopes to actively assist Pitjantjatjara speaking patients and his colleagues by being a clinician who is able to navigate both languages and cultures competently. Pirpanji also plans, as I've said, to be an educator and is currently composing short patient health education material in Indigenous language, including a YouTube video on kidney disease, which won an award from the University of Queensland. He was nominated by Andrea Mason, the CEO of the NPY Women's Council. And when I met with Andrea during my visit to the Northern Territory last month, it was clear exactly how much pride and hope this community has invested in this young man. The significant gap in life expectancy between Indigenous and non-Indigenous Australians is a national disgrace that must be tackled by all levels of government, the private and corporate sectors, and all segments of our community. Through investments in the future of doctors like Pirpanji, we can all help close the gap. I invite Pirpanji to the stage to accept his award and say a few words.
Good afternoon, ladies and gentlemen. Before I begin, I'd like to pay my respects to the Ngunnawal Nation, both past and present. I have a strong connection to my Aboriginal heritage, and I feel that I owe a great deal to my elders and people that came before me. So I'm from Central Australia, in a place called Birbidara Nirunjo. It's on the Tri-State border, and it's a very far away place from UQ, but it's been a great journey to come to medical school and experience the tremendous joy and the challenges that medical school brings. And it's been a completely different culture from what I'm used to, but it's been a fantastic experience. And I've been truly lucky to have had the experiences and support from my community. And it's been a unique upbringing that I've had that's been enabled me to feel comfortable in Aboriginal medical services and also large tertiary centres in Brisbane. But sadly, my people are amongst some of the sickest, and this has been the catalyst for me to begin medicine and my journey. I'm hoping that I can encourage further young people in Central Australia to take up medicine and to come back to Alice Springs and to basically take care of our people, because there's immense value in Aboriginal people taking care of Aboriginal people. My plans for the immediate future is to return to Alice Springs to start internship and gradually pursue a surgical specialty. But in closing, I want to fully express how truly lucky and fortunate I am to be on this wonderful journey in this amazing career. And I'd like to express my sincere gratitude to the AMA again for this opportunity. Thank you all for listening.
Well, thank you, Michael, and congratulations to the recipients of the prizes. It's very inspiring to see the next generation of researchers and doctors here at the AMA National Conference. So on with business, and business requires for me now to thank our conference sponsors. You heard this morning the high regard in which the AMA's work as a health policy body and advocacy organisation is held, and we are lucky to have the range of sponsors we have. So, firstly, I'd like to start by our sincere thanks to the Australian Digital Health Agency, Interrite Healthcare Interiors, Medico Loans, the National Health and Medical Research Council, the MDOs, Avant, MDA National, Commonwealth Bank, Prushka Fast Debt Recovery, Deakin University and American Express. And I hope all the delegates and members will visit the stands in the exhibitors area and return the respect that our sponsors have paid us. The next item of business is the proceedings of National Conference.